So Lassa fever in pregnancy. Lassa fever virus has a high affinity for placenta and fetal tissue, which may contribute to increased disease severity and poorer prognosis in infected pregnant women. So it should be noted that the Lassa virus, it likes, it has high affinity, means it prefers and grows quick in the placenta and in the fetus. So when a woman is pregnant, you know, the Lassa fever goes to where there is a lot of where the placenta is and where the baby is, prefers that place and it multiplies there. And that is why the babies die. You have up to 80% cases the baby may die in the womb, you know, and also in 30% of cases the mother may also die as well. Lassa fever virus has been isolated from fetal organs after spontaneous abortion, and the highest viral titers have been obtained from human placenta. So if a woman has an abortion and you test for the virus has been isolated in fetal organs, in fetal tissue after spontaneous abortion, and the highest viral titer have been obtained from human placenta, the level of the virus in the placenta is usually very high, higher than that seen in the blood. So you can take the blood of a pregnant woman, the amount you see in that blood collect is not as high as the one in the placenta. So that's what increases the risk for the mother and the baby. Most of the symptoms experienced by pregnant women with Lassa fever are non-specific and similar to those seen in other adults. However, some pregnant women experience breast pain without expression of colostrum or milk, which is considered pathognomonic to Lassa fever. The breast sign. There is a breast sign if a pregnant woman has Lassa fever, the breast can get swollen, but there is no milk coming out. That is called breast sign, and it's a particular feature in pregnant women with Lassa fever. And so it's regarded as a pathognomonic feature, a feature that is uniquely seen in pregnant women with Lassa fever. They can have that breast swelling with pain, breast pain, without expressing colostrum or milk. So that should be seen, that should be noted. Lassa fever has significant impact in neonates, children, and pregnant women, with the highest case fatality rates observed in neonates. The studies that were done in this studies that were done by Shadhari et al. So they said highest case fatality rate. Case fatality rate means if you have like 100 people that are infected with a disease, how many will die from that disease? That is the case fatality rate. So case fatality rate is highest in neonates, that is children less than 1 month old, up to 66.7% and 75%. In two studies. Then followed by children older than neonates but are still children, 6 to 49.3%, pregnant women 33.7%. So the highest death rate is seen in newborn babies, followed by older children, then followed by pregnant women. So death is more common in children. Prevalence of Lassa fever ranges from 0%. Lassa fever in children ranges from 0% to 40.5%. Co-infection with malaria are common in pediatric population, which potentially delay the diagnosis of Lassa fever and therefore may have an impact on the overall prognosis, especially in severe cases. So a patient with Lassa fever can also have malaria at the same time. So you do the malaria test. The malaria test is showing positive or showing presence of the malaria parasite. So it's that could confuse the diagnosis. There should be note that the child have malaria doesn't mean the child cannot have other things. That point should be noted. Two, co-infection can delay diagnosis of Lassa fever and have impact on overall prognosis. Similarly, apart from malaria, clinical pneumonia was present in about 33 to 40% of children with Lassa fever, which can also cause delay in diagnosis as pneumonia is commonly associated with bacterial infections. So the patient may present with fixtures suggestive of pneumonia, have fever, cough, difficulty in breathing, you know, and you rightly suspect pneumonia and you're treating. Pneumonia is often caused by bacteria and you're treating with antibiotics. But Lassa fever is a virus, so the antibiotics, will only have effect if there's a bacterial co-infection, you know. So testing for Lassa fever as well as co-infections such as malaria, typhoid, shigellosis, yellow fever, HIV, tuberculosis will be an important approach for differential fever and sepsis diagnosis in children in endemic regions of Africa. The low rates, the report of hearing loss is lower in children compared to adults, but it's attributed to limited screening for hearing loss in surviving children. So, to mention, ribavirin has been considered as treatment of choice for Lassa fever disease, although there is no direct evidence of efficacy or safety in children or pregnant women, since these populations have not been included in clinical trials. Evaluations of treatment in these populations is needed to ensure appropriate doses are used for efficacy and safety. The urgent need for effective vaccines against Lassa fever is driven by the significant morbidity and mortality associated with the disease, as well as challenges around controlling reservoirs and the risk of outbreaks and potential pandemics. So there is need for vaccines.